Okay guys, the topic that we will be dealing now will be the pectoral region. As we all know, the pectoral region is present in the anterior thoracic wall. It consists of three main muscles, that is the pectoralis major, the pectoralis minor, and the subclavius. And here, the deep fascia of the pectoral region is known as the pectoral fascia. The clavipectoral fascia lies deep to the pectoralis major. And now moving on to the pectoralis major muscle. It is the largest and most superficial muscle on the pectoral region. Origin arises by two heads. It has two heads of origin. First one is the sternocostal head. It arises from the anterior surface of sternum and upper six costal cartilages. And now to the clavicular head. The clavicular head is from the medial half of clavicle bone. And now on to the insertion. It inserts into the lateral lip of the intertubercular sulcus of the humerus. And then the nerve supply is from the medial and lateral pectoral nerves. Actions. It causes the flexion of shoulder joint, adduction of shoulder joint, and the medial rotation of the shoulder joint. And now we move on to the pectoralis minor muscle. Its origin arises from third, fourth, and fifth ribs. Insertion is into the coracoid process of scapula. Nerve supply is from the same medial and lateral pectoral nerves, just as in pectoralis major. And now to the action. Causes protraction of the scapula. And the most important point is that it has no such effect on the shoulder joint. It causes no movement in the shoulder joint. Another important thing is that it divides the axillary artery into three parts. And now moving on to the subclavius muscle. It does nothing but steadies the clavicle. It provides stability to the clavicle bone. And now we move on to the important question, that is the deltoid muscle. It is the muscle that gives the rounded contour to a shoulder. It is divided into three fibers: anterior fibers, the middle fibers, and the posterior fibers. The middle fibers are also known as the acromial fibers or lateral fibers. And another thing, deltoid doesn't cause adduction. It is an important point. It does not cause adduction at all. And now we move on to each and every individual fiber of the deltoid muscle. Anterior fibers. Origin is from the lateral 1/3 of clavicle. And insertion is from deltoid tuberosity of humerus. And then on to the middle fibers or acromial fibers, whose origin is from acromion process of scapula, and hence the acromial fiber name. And insertion is into the common insertion, that is the deltoid tuberosity of the humerus. And posterior fibers. Origin, spinous process of scapula, and insertion, deltoid tuberosity of the humerus. And now we move on to the nerve supply, which is by the axillary nerve. Actions of deltoid. For anterior fibers, it causes flexion and medial rotation. For acromial fibers, it causes abduction. And for the posterior fibers, it causes extension of the shoulder joint. Moving on to the applied part of the deltoid muscle. First one is the intermuscular injection, which is delivered in the lower part of the deltoid muscle. This is mainly to avoid injury to the axillary nerve, which mostly passes in the upper part of the deltoid muscle. The groove between the deltoid and the pectoralis major muscle is known as the deltopectoral groove. It contains the cephalic vein. And now we move on to the clavipectoral fascia. It is the next important topic in upper limb. It lies deep to the pectoralis major muscle. Another important thing is that it encloses two muscles, the subclavius and pectoralis minor. Okay. And now moving on to the attachments of clavipectoral fascia. Medially, it is attached to the first rib, laterally to the coracoid process of scapula, superiorly the clavicle, and inferiorly, after enclosing subclavius and pectoralis minor, two muscles, it continues down as the suspensory ligament of axilla. And there are four structures piercing the clavipectoral fascia, which are the first one, the cephalic vein. Second one, the acromiothoracic artery. Third one, the lateral pectoral nerve. And fourth one, lymphatic groups from the pectoral region. And that's it for today. And that's easy anatomy for you guys. Please like and subscribe. Thank you.